Hi, good afternoon, good evening, everyone. So we are now still waiting for people to come in. Yeah. Hi, hi. Hi. You can see now a lot of people coming in. So maybe we give about like 5 minutes time to let everyone to join us first. Hi, good evening, everyone. Yeah, thank you for joining us for this Zoom plus our Facebook Live session to talk about the elderly dry eye care by Dr. Kong Wai Hong, our medical doctor come traditional Chinese medicine physicians, and also Mr. Sim Wei Kiat, optometrist. So shall we start or we still wait for a few more minutes to let more people to join us? So can you hear my voice? If you can hear my voice, can you say yes, yes, yes at the Zoom and also the Facebook?
Yes.
Yeah. Thank you. Yes.
Yes, I can hear you.
Yes.
So have you all have a after dinner, right? Right now it's 8:30. Yes.
Yes.
So while waiting for more people to come in, maybe I can explain a little bit about our two speaker profile. Yeah. So that I'm MC for today. So my name is Olivia Kwa. I'm from iElder Asia. So we are medical product supplier specialized in the senior care, senior products. So that let me share about these two speaker profile. So we have number one that Mr. Sim Wei Kiat. So he's an optometrist. He's a office at My Optometry based at Cyberjaya, Selangor. So he's a member of the Association of Malaysian Optometrists and also the member of the World Council of Optometry. So he's very dedicated at primary optometric eye care, specialized in the senior vision care and also the senior care. So, and Dr. Kong has more than 20 years experience in the Chinese medicine and also more than 10 years in Western medicine. So he was trained at a Chinese medicine, traditional Chinese medicine physician in Guangzhou University in 1998 and pursued his medical doctors in Premier State. And then he completed his PhD in the TCM from Nanjing University in 2018. So he's a resident doctor at Polyclinic Bedana, and he's also at Cheras Bedana, and also the founder of the Asian Integrated Medical Syndrome Berhad. He's a visiting lecturer at the university, Inti University and Xiamen University. His vision is to integrate both medicines, the best from the East and the West. So this whole program that we start with Mr. Sim will share about 15 minutes presentation on the optometry way on the senior eye care, especially in the dry care topics. And also Dr. Kong will share 15 minutes on the TCM way. At last, we will answer any questions that if you have any question raised. So this whole session will about 30 minutes to 45 minutes. So, and now I pass the floor to Mr. Sim. Mr. Sim, please.
Thank you so much, Olivia, for your kind introduction. So nice having all of you here and this lovely evening. So I'm very pleasure to have the collaboration with Dr. Kong, a very much respected TCM doctor and medical doctor with us here today. So I'll be explaining a little bit more about what is dry eye and how it affects on elderly, especially for today. So now, a little bit introducing for myself. My name is Sim. I'm optometrist. So now, what is dry eye? So for the very comprehensive definition of dry eye is actually a multifactorial disease of our ocular surface. So it's characterized by the loss of homeostasis of the tear film and accompanied by the ocular symptom in which the tear film instability and hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities play etiological roles. So this is a very comprehensive meaning of dry eye. So I'll be further introducing on in details in a little bit. So next, I will actually talk about tear film. So most of us thought our tears is only water, but actually it is not true. So we have three layers of our tears. So the inner part of our tears is actually consists of mucin. So mucin is actually help in stabilize our tear film and hook our water with our epithelium cells. So at the middle will be the water, which make up quite a lot of our tears, and the outer parts will be the lipids. So the function is to prevent our tears from evaporating very fast from our ocular surface, which is our cornea. So we do have a little bit, the type of dry eye is quite something to look at it, but simplify it. We have three types. So the first type will be aqueous deficient dry eye. So it's the lack of water in our tears. Secondly, it will be evaporative dry eye, meaning that our tears, it is not too stable and evaporate too fast. It does not last that long on our cornea. So, and many of us, they have the mixture of these two. So it's not quite clear distinction between these two dry eyes. So we can have a mixed type of dry eyes as well. So now what does dry eye feels like? Especially now when we have working from home and we are looking at the computer right now. So these are the contributing factors, and we can feel dry, irritation, the burning and stinging of our eyes. We have scratchy eyes as well, gritty feeling. Sometimes our visions get blurry, watery and tired eyes. So not everyone experience the same. So some of us will have a little bit more severe effects, some have lesser. So what trigger of this eye symptom? First of all, it will be aging. So that's why we have this session to explain a little bit more about elderly dry eye, hormonal changes, environmental factors, digital device uses, all of us now, contact lenses, medication, and our health conditions as well. So now we're going to talk a little bit more about aging for this session. So our eyes changes as we age, and it becomes more susceptible to developing dry eye. So what causes and what are the things that causes dry eye in elderly people, especially when we age? So now, based on studies, female have more dry eye compared to male, and Asians have more susceptible to dry eye compared to Caucasians. And then our hormonal changes, especially if we reach menopause stage because of the hormone changes, and our ocular surface problem, such as the pterygium pinguicula, which is the changes on our conjunctiva, the white part of our eye, and meibomian gland dropout, which is the oil gland on our eyelids there, which supply the oil to our tear film. So if we are taking some medications, antihypertensive, antidepressant, just to name a few, So this has a little bit side effects and it can cause dry eyes as well. And lastly, our health condition, if you are diabetic, high blood, glaucoma, depression. So sometimes this is the condition itself causes us to have dry eye. And many other time it is because of the medication we take to counter off these health conditions. Now, what's so great about dry eye and what's not so great about dry eye? So it can actually negatively affect our quality of life and our functions, daily activities, and workspace production. So a very severe dry eye, it can actually cause us depressions as well in some studies and causes more problem in their daily activities. So I would like to talk a little bit more about the diagnosis of dry eye at our optometric practice, which is at Tamrin Square, Sabarjaya. So we do have two objectives, which is first, we'll be differentiating the type of the dry eye. And secondly, we would like to actually know how severe is your dry eye. Okay, so we do have this long list on diagnosing of dry eye. To simplify it, so number one, we'll be asking the history, like all of our eye checked. So including the question related to the sign and symptom of your dry eye, and risk factor analysis, including smoking, medications, contact lens wear. Third, we'll be doing some diagnostic testing. So the screening normally will be asking on the questionnaire, dry eye questionnaire. And secondly, the homeostasis markers. We'll be checking in detail in how the dry eye causes the changes on your cornea. So sometimes we do have ocular staining, which is the wounds on your cornea, how bad it is, and how long that's, the tear stays on our ocular surface. So number four, we'll be classifying the subtype of the dry eye. So either it is an evaporative, abnormal lipids, if you have MGD, which is the meibomian gland dysfunction, the oil gland dysfunction. And number two, whether you do have enough tears for your eyes, or they are normal volume or low volume. So lastly, we'll be identifying on the severity of the dry eye, mild, moderate, or severe, because this can actually lead to our treatment later on. Okay, so these are some of our diagnostic testing. So first of all, will be, it's not limited to all this. We do have some other testing. So number one, we'll be checking on your tears breakup time. In short, we like to call it TBUT. So this is actually to know how your tears last on your cornea. So normally it lasts longer than about 6 or 7 seconds by using the fluorescence. So, and then we'll be using some machines to check the non-invasive tear breakup time. So the machine can do more than just checking on your tear breakup time. So we do measure on the volume of your tears. And lastly, we'll be checking by using infrared to see whether your oil glands, they're still healthy or they do have dropped out. Is that some of your oil glands has dying off and things like that. So this leads to our next steps of treatment. And then coming to the interesting parts, the management of our dry eye and what should we do? So after we conclude on what type of dry eye you have. So we do have some simple idea on how it can ease the bothersome of the dry eye symptoms. So number one, our main focus is to have the treatment for your tears insufficiency. So two types of eye drops, these very common eye drops. So number one, we target on your aqueous supplementation, means we add in some water to your tears if there's not enough. Secondly, we do add in a little bit of oil to your tears as well. So these are the artificial tears. Secondly, if we notice you do have oil gland dysfunction, or you do have a lot of bacteria on your lids, which causes the inflammation of the eyelids, which we call blepharitis. So normally we'll be prescribing lid hygiene. I'm sure all of us has know about hand hygiene now because of the COVID. So we wash our hands everywhere we go. So, and then we brush our teeth every day. That is what we call our oral hygiene. But not many of us know about lid hygiene. So we don't know actually we need to get our eyes clean. So lid hygiene is actually a very useful hygiene things. So to clean up of our eyes. Yeah. So to prevent dry eye as well. So meibomian gland dysfunction, number two, on the treatment of lid abnormalities. So we do prescribe eye drops as well for that, and warm compression. So it gives a little bit heat on your eyes, besides relaxing on your eyes, you feel more relaxed. So it's actually softened up on the oil, which we melt out of it, so it can flow more freely, so contribute and stabilize on our tear film. So number 3, we advise on the diet. So drink more water, eat a little bit more of fatty acid, essential fatty acid, because our body can't produce on that. Omega-3, flaxseed oil, yeah. And number 4, the local environmental consideration. So we'll be depending on what type of medication or eye drops you are taking, and then systemic medications. So that's why when you come to our clinic, we ask a lot of questions, so to have a whole idea on what your eyes conditions are. So like us looking at the screen now, please remember to blink. So because when we focus too much, our blinking rate, it will actually reduce. Blinking is not enough. You have to blink fully. So close fully, so the tear film will spread out evenly on your cornea. And then our conditions, whether we have environmental pollutants and things like that, it can contribute to our dry eye. And lastly, contact lens wear. So coming to the complementary medicine. So these are one of the interesting things which will explain more in depth by Dr. Kong. So this is a very interesting session. So herbal and natural products. It has been widely used in many countries for thousands of years, especially for Chinese. So and then for acupuncture as well. So it has been proven to be successfully treated for dry eye. So without further ado, I'll be ending my sessions now, and I'll pass the floor to Dr. Kong. Dr. Kong, are you there?
Hello.
Yeah, I'll pass the floor to you, Dr. Kong.
Okay, thank you, Mr. Sim. Good evening to everyone. Since we know all the modern concept of the dry eyes, so now we are going to more profound traditional way concept of the dry eyes. So nowadays, digital lifestyle requires our eyes to read. So especially for this COVID-19 pandemic, so we stay home and with more time to read computer and device. That's what we are doing now. So that's why giving our eyes extra burden. So after the lockdown, the dry eyes, eye pain, so even etc. eyes disorder and reduced visions becomes so-called secondary pandemic issues. So I think basically this table, this photo, you can see excessive stress, even overreading, sedentary lifestyle, and the lack of the social network. So because lack of the social nowadays, even we want to meet together, we also through webinar, through webcam, through so in front of computer. So even the nutritional deficiency. So air conditioner. Now I think are we sitting in the air conditioner room? So insufficient sleep. Nowadays, our phone, there are so many information through WhatsApp. So that's why even until we can't really read through all the information until sleep very late. Lack of the outdoor exercise. So everyone stay at home. So that's why even all the gardens will lock down also. So we can't go to the garden to do the exercise. So the next why? I think we have gone through, Mr. Sim already talked about this, the tear film. So the tear film is quite salty. When evaporates, the saltiness increase, which make our eyes burn and sting. Yeah, that's why we feel very discomfort. Yeah, uncomfortable. So chronic disease, especially diabetes, yeah, Sjogren syndrome, and etc. Drug, antihypertensive drugs, anti-sedative, antidepressant drugs, even antihistamine drugs also will cause a lot of side effects, and etc. Next. So the TCM perspective on dry eye, the most important, I think, based on the flow of the energy in the body, because our body, so-called the balance, must achieve the balance between the qi and the blood flow. So the energy called qi need to flow uninhibited for the good health. The energy flow through meridian, the channel, the qi channel, invincible energy channels. So the TCM seeks to balance the meridians using acupuncture and herbs. Next. So this show the liver and the kidney meridians. You can see the kidney, the liver meridian from the leg goes up to the eye, and the kidney meridian as well, from the leg to the eyes as well. Next. So the liver meridian opens the eyes. What does it mean? Because normally in TCM, we always say organs, and organs opening through an organs. Like our eyes normally is the liver meridian to open our eyes. Common liver imbalance include liver yang rise and liver qi stagnation, even include liver blood deficiency. So treating the liver meridian can increase the natural tear production. The deficiency in the kidney meridian can also cause dryness, especially kidney yin deficiency, particularly for the woman over 45 years old, where menopause causes the internal dryness. Next. So here shows some research done from different countries, from even China, Korean, even America. They have done a lot of study, Chinese medicine and integrative Chinese medicine with the Western medicine on dry eyes treatment. Next. The efficacy and the safety of the acupuncture are combined with the Western medicine for dry eyes. Next. And acupuncture for the treatment for dry eyes. Okay, next. So there are many studies have done. So here you can see 5 organs, 5 elements: liver, heart, spleen, lung, and kidney. You can see our eyes. They also can classify to the 5 parts of the eyes represent 5 elements and 5 organs. We can see at the iris part, the view equal to water, the zhang organ, kidney. So the kidney represent the pupil, lens, and main body of the eye, retina, macula, and optic nerve. And the other ones, lung, conjunctiva, and sclera. So that's why when we have cough, when we're having coughing or some lung infection, our sclera will turn redness sometime, yeah? And the other things, heart, the canthus and the tear ducts. So heart, when we feel sad, so of course we will tear, we are tearing. And also the other liver, cornea, and iris. And the sprint represent the eyelids. So here, from here, we can see through the eye, through the opening, to the observation of the eyes, we can see, we can make a diagnosis which organ have the problem through TCM perspective. So, and the right lower photos, they're showing the acupuncture needle on the face. Yeah, there are so many needles there. Don't be scared. Yeah, you won't be hurt. Okay, next. So next, here show a lot of acupoint. There are so many points. Later, I will try to show or how to do some massage or acupressure point. So there are so many points. 睛明穴承泣穴 太阳穴 okay, even the 足三里 okay, next. So here, acupressure massage, yeah, by using the fingers, okay, next. So the Chinese medicine patents formula for the dry eyes, like 明目、地黄丸、逍遥丸、the 猪精丸等. Okay, next. All this is a prescription, that's herbal prescription pill for dry eyes. Next. Here I'm going to talk about herbal tea. So the chrysanthemums and the goji berry teas. So the chrysanthemum flower have the heat clearing properties which are important in helping hold off red and dry eyes. And goji means goji, gaogei. Chrysanthemum means the gukfa, 菊花. So the goji berries are beneficial for the kidneys, the lungs, and the liver, and build the yin fruits such as tears. So we can make it. We can buy some chrysanthemum flowers and goji. Just put some hot waters and just make it like a tea and drink every morning and even at night time. Okay, and then we can eat the berries as well, the goji berries. Okay, next. These the chrysanthemums teas and the goji berries. You know, goji berries, fat-free and low sodium and cholesterol-free, and with vitamin A. This is a prescription for the 淄博地黄环 is goji, the goji. The first herbs is goji. The next, the second one is the chrysanthemum flower. The third one is 熟地, 山茱萸, 山药, and 泽泻, 茯苓, and 牡丹皮. Okay, next. So how to keep your eyes moist naturally? I think most important is the water. I think we must drink more water and eat more green leafy vegetables. Avoid all the toxic fats and drink more waters, and try drink some juice. Avoid any foods which may hurt ourselves. Yeah, next. And of course, lifestyle for the dry eyes, exercise, use of humidifiers. Remember to blink your eyes, check your medications, may cause the side effects. Then may discuss with your doctors, may change to another types of drugs. Gently massage your upper and lower lid. Yeah, next. So here, of course, you may use artificial tears, and this is punctal occlusion. Punctal occlusion is a punctal plug will be put by the ophthalmologist to block the tear sac. Yeah, in order the tear remain on the eye surface. Okay, to reduce the dryness for the eyes. Okay, that's what I want to share now. And then now I try to show how to do some massage, okay, of the acupoint. Sandra. So everyone can see me? Hello? Ah, okay.
Dr. Kong, we can see you.
Yes, we can see you.
Okay.
Yes.
So basically, we do some massage. Of course, basically we use these hands. Yeah, we put like this. Okay. Use this curve. Yeah, this point. Slightly compress our eyes. Of course, we can use our both hands. Yeah, and compress the eyeball. Doesn't matter. Just gently touch it, compress it, and move to the side way. Okay, do 5 times. Slowly, yeah. Here, gently 5 times. Yeah. Okay. Next step, we use this to this angle, this angle. You can see or not? This and this. So this is a bony part and this bony part. So we must touch to the upper, we call supraorbital arch, and here. We can feel the bone here and lower part of the eye. So we both bony part touch together, and then we sheave, we press. You'll feel some tender. You feel some tender, so you can do both sides. Yeah, you feel some tenderness. Yeah, doesn't matter. It's very feeling relaxed or feel some tenderness. Okay, this do 5 times. Do 5 times. Okay, 5 times. Okay, this is the beginning of massage. The next, we do some we do some acupoint massage. Okay, here, this is the eyebrow, the inner part of the eyebrow. Yeah, this is the external. So this is the internal. Okay, we put our 2 fingers here, here, and turn. You can turn clockwise 5 circles. 5 circles. 5 circles. Then press it, release it. Press it, release. Press the point, release. You will feel some tenderness as well. Press, release. Press, release. Press, release. Press, release. Okay, this is the 5 times. So another point, 沉气, okay? Here. Here is the about straight line downward from the iris. Straight line downward to the iris. The bony part, yeah, here. You can feel it here. So when you press, a bit tender. Okay. Do the same things. You do some cycles massage, clockwise or anti-clockwise, doesn't matter. 5 cycles. Then press it. Press, release. Press, release. Press 5 times also, release. Press, release. Press, release. Okay. Then next acupoint, 太阳穴 here. 太阳穴 here. How to, okay, this is eyebrow, the lateral side of eyebrow, and the angle, lateral angle of the eye goes together here. Cross, when the 2 lines meet together, that is the point, okay? Okay, both sides same. So same, you turn, you do the cycle massage, okay, for 5 times. Okay, then you press it, press a bit gentle and feel tenderness and release. press, release. Okay, do the 5 times. 2, press, release, and press, release. Okay, this is the same simple 5-step of the eye massage. Okay, thank you. Okay.
Hi. Yeah. Any questions so far about these two speakers share about dry eye?
I think now we move into Q&A session, right?
Feel free to ask any questions that they are happy to answer any questions that you have it. Yes, you can put your questions in the Zoom chat and also the Facebook Live. Oh yeah, I seen that someone shared about that. So asking about the name of the center, right? So we have 2 speakers. So Mr. Sim, he's this optometrist is at this Cyberjaya. So Mr. Sim, can you share your location of your center?
Yep.
And Dr. Kong is based at Cheras Perdana. So and you can go to ielder.asia to see the information of the address. And also the second question that we have it.
Hello, can you hear me? No? Hello.
Any treatment for
Yeah, we can hear you.
floaters? So floaters, any treatment for floaters? Can Mr. Sim or Dr. Kong answer this question?
Can you hear me? I'm Raymond. Hello.
Floaters, there are many causes to cause floaters. So I think basically you need to see ophthalmologist first to find out any abnormal in the structure of retina or the eyeballs itself. So it depends, yeah, it depends. So of course in TCM, normally we will use acupuncture and Chinese herbals to treat any kinds of the eye disease according to our Chinese perspective and theory. So basically we can see some improvement. Yeah?
I think that's a question by Mr. Raymond. I think you can proceed.
Sim, you want to answer these questions? Mr. Sim, you want to answer this question?
About the floaters, so normally floaters, we need to...
We can't hear you. Can you unmute your mic?
Is it okay now? Yeah, okay, thank you. So for floaters, like Dr. Kong said, we will be...
Mr. Sim, we can't hear you.
We'll be doing a dilations. So usually done by ophthalmologists. So at our center, if the floaters is caused by natural causes, is the jelly inside your eyes, then nothing much of that.
The TCM can help cataract or glaucoma. Of course, the cataract itself, it depends on early stage or late stage. Of course, late stage already matured, so the types of cataract have to gone through the surgery. Yeah, I think that is the fastest way and the safest way. So if the early stage, we try to avoid operation, then we may do more eyes acupressure massage. Of course, we have to have a good lifestyle, especially nowadays all these digital worlds. I think we need to avoid all these all these type of device. Yeah?
Hello, I'm Raymond again.
And the glaucoma is a really serious disease. Of course, can classify to open and close. Yeah. Open glaucoma is a bit not so severe. Closed glaucoma will cause a lot of pain, especially at the eyeball, even can cause blindness. Yeah. So I think, of course, first of all, must see ophthalmologists, may have some laser therapy, some operation may improve the eyeball pressure. Of course, acupuncture may achieve a good, very good result. Yeah? Sometimes if we can integrate both sides, both ways, you may achieve an amazing result.
Can I
Even
ask?
I can share my experience. I actually, one of my patients come to see me actually is to treat the headache. So I did few sessions of acupuncture for him to treat the headache. So, but at last, he told me that because he never mentioned about the glaucoma, but at last session of the acupuncture, he told me that his glaucoma improved a lot. But actually, I'm not treating his glaucoma, but we just treat his chronic headache. But at the same time, the glaucoma have been improved.
Hello.
So,
Okay, we have questions about from Xia Huang Lao from the Facebook Live. His question is, sometimes my eye is very watery, occasionally very dry and itchy. What is the cause?
Mr. Sim, you may answer.
Okay, so for that questions for dry eye,
I can't
because
hear you, Mr. Sim.
is it okay?
No sound.
Can you hear me now?
It's okay. It's okay. It's okay. Please proceed.
Okay.
Please proceed.
So for dry eye is multifactorial. So sometimes it can be actually dry eye as well for that questions. So watery, some people they will think I have watery eye, so I have too many water. But it's actually the natural response from our body, because when your eyes is too dry, so the brain will tell eyes to secrete a little bit more water. But the watery eyes, the tears film is actually not that stable. So when normally we have watery eyes or you start tearing, so normally it's a little bit later stage already. It's like our normal body response. So better to have the eyes checked and see what kind of dry eye you have and how severe it is. Yeah.
Hello, I'm Raymond. Can I speak again?
Yeah, Raymond, there you go.
Okay. You see, for the past 3 months, I visited the what I call eye specialist. It's a hospital eye specialist. So my eye, after treatment, he says my eye has mild conjunctivitis. It's a top part a bit itchy lah, a bit itchy. And the morning when I wake up, there are a number of what they call an Nancy, you know, they call it Nancy.
Discharge.
Discharge, they call it discharge. So, and then they give me this cream, the Optomer cream, which is antibiotic. So I've been already applying for the past 3 months. I put what we call morning and night 3 times according to what the doctor says. But it's still there, you know, for 3 months already. So I'm wondering what's the reason. But I have a little bit of very light glaucoma, very light one. So they gave me also a little bit pressure and also glaucoma medicine. I'm also applying now. But the problem is that it's the itchiness for the past 3 months already. For the last 3 months, there are a lot of discharge every morning. So I'm just wondering what's the reason so long can't heal.
Dr. Kong, you like to address on this? Anything from your side?
Very hard one to
From
say.
Mr. Sim, do you have, I think you may go to Mr. Sim there and maybe have
Check it.
check whether any problems first. Yeah, and then because of course, yeah, discharge may have many causes. Yeah, may have many causes. Of course, maybe sometimes you may use some water, maybe recommend by Mr. Singh to have a eye washing. Yeah,
Hot water. I also do that in the morning.
Oh, you did it now.
I do that in the morning also. But still the same, the symptom persists for 3 months already. So I also don't know what's wrong with the eye now.
Okay, so for Raymond, you can actually contact us because normally for antibiotic, you shouldn't be using that long, especially for 3 months time. So do you go back to follow up with your eye doctor?
Not yet, but I'll try to make an appointment again and see how.
So better to follow up with your ophthalmologist because sometimes it can contribute to, it might due to other reasons as well because it's not.
It's a hospital. It's a hospital. It's a Sedang hospital. Eye specialist.
I see. So if you have any concern, you can actually just drop by so we can have your eyes checked and see whether anything else besides your dry eye and what causes the itchiness and the discomfort of your eyes. Yeah.
By the way, the telephone number and is in the chat group there. The telephone number and the address.
Yeah, it is in our Zoom chat. So we have one is my center at Sabajaya, another one is Dr. Kong's at Teras Perdana.
Teras Perdana, near where, Pastor?
So
okay, I find out. Don't worry. Okay, thanks.
I have a question, please. I have a question about astigmatism.
Yes, Miss Irene.
Why is it that my astig from 100 progressed to 300 and now 500? What can I do to stop it from worsening or even recover instead?
Okay, that's a very interesting question, Miss Irene. So astigmatism, there are a few reasons. Whether you have been constantly rubbing your eyes, or it might due to any other thing inside your eyes as well. So we will definitely need to check your eyes to find out more on what causes that, and to find out how long does it progress. Is it progress that fast? So there's another condition what we call keratoconus as well. So there's a fast progression of your astigmatism. So we just want to rule out on that.
What are you trying to rule out, Mr. Sim?
It is not due to any other eye diseases on your cornea.
Yeah, I don't know whether the HUKM doctors have been doing the right thing. But I go to them every 6 months.
I see. So actually,
I wonder whether they.
So it needs to depends on what sort of because we need to look at your eyes as a whole. So that is a very good question. So it's better to get your eyes checked thoroughly again, and we can actually suggest you on what your conditions are and what are the causes you have.
Sorry, I thought I muted.
Thank you, Ms. Erin.
Any more questions from the room before we proceed to ask, get the question from Facebook lah?
Can I go back to the astigmatism? Can it be corrected other than wearing glasses?
Yes, so there are various ways of correcting astigmatism besides glasses. Astigmatism will be very normal, like our short-sightedness, long-sightedness, and things like that. So besides glasses, we do have contact lenses, and it can be corrected by surgicals as well. So, but it needs to depends on what kind of causes you have, because when you have astigmatism suddenly increase that much, so sometimes we call it keratoconus when you are diagnosed with that. Hopefully not. So it needs different type of treatments as well. So it's very important for us to find out what kind of astigmatism you have and what causes it.
I see. Okay. Yeah. I think about that. I consider. Thank you very much.
Thank you, Ms. Irene.
So if there's no question from the room, we'll pick one from Facebook. So there's one from Mr. Liu. I think he's just asked, "Hi doctor, is the result immediately shown if using the acupuncture?"
Do you mean the effectiveness? Immediate,
I think so, yeah.
immediate effects? I can't. I don't understand the question.
I think it's relating to dry eye lah. Is if it's acupuncture, will the effect immediate or not lah?
Oh, it depends, but it still because acupuncture it still depends on the acupuncturist, the skill of the acupuncturist and the knowledge of the acupuncturist. But some of because this, but my skill, I can say, because I have gone through some many cases, I can give the immediate effect. That means if you feel pain, I can relieve the pain immediately. Even dry eyes, when my needle go in to your the acute point, the eye start tearing. Also have this experience, but of course it still depends, because now just now we already talked about so many causes of dry eyes. So of course we have to rule out what type of causes. For those who are using drugs like antihypertensive or the antihistamine, acupuncture also may have the effectiveness to reduce the side effects of the drugs. Okay.
Okay. So anyone from the room here? If not, then we'll take another few more from I think Facebook.
Dr. Kong.
Yes.
So can I make an appointment to see you? Like,
Sure.
Yeah.
That's what you may call us. You may go to our website.
Oh, I see.
Later
Okay.
we will give you the number. Okay.
All right. That's good. Yeah. Thank you. Yeah.
All right. So there's one more. There's one question from the internet. I think Mr. Tony Chan. What are the consequences of not treating dry eyes?
The most common problem will cause ulcer, cornea ulcer. Ulcer will cause blindness. Of course, not so. It still depends on severity of the dry eyes.
Yeah, that's correct. Totally agree with Dr. Kong. So normally people, when they come in, I have dry eye, so what can happen out of it? So normally we'll be telling them the most serious case of dry eye, you can become blind. So they get shocked, but actually it can be happen. Yeah. In very severe cases.
Mr. Sim, I may have one question. Because for what I know, the eye drop, there are so many eye drop in market. So for what I know, there are some preservative inside eye drop, because the preservative also can cause dryness as well. Is there any good eye drops you may recommend to all these audience or to all of us?
So basically in the market, we have a lot of type of eye drops. So when you go to the pharmacies, anywhere, so you'll be seeing something like this, something in the bottle, something like this. So there are a lot of eye drops. So normally in some kind of eye drop like this, especially in bottles, so they do have preservative, and some kind of preservative is actually very toxic to our cornea if you use in long run. So it can actually causes you to have dry eye. So when you have dry eye, when you use it more, so it creates a very vicious cycle. So your eye become more dry afterwards. So a better type of eye drop will be something like this, the one without preservative. So once open, it only uses once or 24 hours. So depending, these are better kind of eye drops, and we actually need to, depends on which type of dry eye you have, because not every eye drop make the same, and not every eyes reacts the same to the eye drops. So, but generally a better type will be the non-preservative, or you can choose the bottle type, but with a better kind of preservative. Thank you, Dr. Kong.
Yeah, but
Mr. Sim, I have a question. Mr. Sim,
Yeah.
I was asking you about astigmatism. I have dry eyes. I have been prescribed 2 vials, preservative-free, but unfortunately, I'm quite lazy lah. Instead of using 2 vials, I use 1 vial a day. Usually before bed and upon waking up, that's when it's very convenient next to me. During the day when I'm out, I don't carry it out with me. So I'm wondering if I don't keep my eyes moist, hydrated, does it mean it contributes to my astigmatism, or will the cornea get scratched due to the dryness? I don't know. I'm just using my own language. I seek your clarification. Thank you, Mr. Sim.
Okay, I understand your question, Ms. Irene, and a lot of people, they do have these kind of questions as well. It's very common, very good question you're asking. So what happens when your eye is dry? Sometimes it gets itchy. Itchy is one of the sign of dry eye. So when we rub our eyes, sometimes it can induce astigmatism as well. So we can't rule that out unless we really have your eyes checked out. So I think better for you to have your eyes checked thoroughly again, Ms. Irene. But if the drops works well, and if you're using the valve one, so continue to use that so that your eyes stay hydrated, and besides any other things. So eye drop is only one of the ways. So we do have many other ways to treat on dry eyes as well, and it's not limited to eye drops. Eye drop is the very basic things. Yeah, hope that answers your question. Yeah.
Yes, thank you. But my main concern is astigmatism.
Correct. So sometimes
500 is very high.
It is. Yeah. So we need to actually find out why is it that high, and what causes that. Yeah,
thank you. I need to look into that.
Sure.
But you're in Cyberjaya, Mr. Sim.
Yeah, find ophthalmologist or any optometrist to get your eyes checked thoroughly, Miss Irene. So any optometrist near you.
I have been to Isaac, but it was with regards to some other, to ascertain whether I have another condition, and he ruled it out. So I forgot to ask him whether he deals with dry eyes or not.
I see.
No, not so much dry eyes, astigmatism. Astigmatism was, the reading was given to me by the optometrist, also in Isaac.
Yeah. So it's very common in medical field. So we seek second, third, fourth opinions of that. So yeah, no problem. But I believe the doctor and the optometrist did a very good job in diagnosing and things like that. So sometimes it happens. So, but I can't really say anything unless I have your eyes checked thoroughly. Yeah.
I would like a second opinion, of course. For remedies especially. Yeah, thank you, Mr. Sim.
Thank you.
Dr. Sim. Dr. Sim. Hello.
Hi.
Yes. I just now you mentioned about the eye drop. Yep. So what about this Hilo, the one that the Hilo thing? Is this a preservative free?
Yeah, good question. So the Hilo you are using now is without preservative. Yeah. So it is a better kind of drops as well, but it depends on the type of dry eye you have.
Why? What do you mean by that?
So if your dry eye is the evaporative type, so normally we'll be advising the drops with a little bit of oil so that it lasts longer on your eye. But that drop you're using is a very good one, so you can actually continue with that.
But they have 2 types. One is this one, and the other one is the gel. So I do buy 2 types.
Yeah.
The gel, is it the better one?
The gel is having higher concentration of hyaluronic acid, so it helps to heal up your eyes a little bit more. And because it's gel, so it lasts longer on your eye. So normally we advise that when you have very severe dryness, discomfort, or when you're going to sleep. Yeah. so it doesn't blur your vision that much. Yeah, so you can actually not only for one kind of drops, it's a very good thing you are doing. So sometimes depending on the type of dryness they have, we might need to actually recommend different type of eye drops for the same eye.
So which means that you're saying that the valve one is better, is it?
The non-preservative one is generally better for a more moderate or severe dry eye. So I would say
even better than this high-low, even that.
Not really. It needs to depend on your dry eye condition. But the one you are using, the Hylocomat you are using, is without preservative due to the unique design they have. So you can actually continue with that. So no problem.
You don't have to switch to the valve. Do I need to switch to the valve?
No need. That is without preservative as well. Yeah. Okay. But if it's not working well with you, so sometimes if it works well with you, continue with that. Yeah, continue with that.
Mm-hmm.
Thank you.
Thank you. Yes.
Mr. Sim, I'd like to say something about gel. When I apply the gel, I find I'm kind of, inverted commas, blinded for a while. I can't read for 5 minutes, 10 minutes maybe. So I opted for the liquid. Would like your comments on that. So
we do have different type of artificial tears. The gel type, normally it lasts longer on your tears, and it definitely will blur out your visions for a little bit while. So put that when you are not doing anything which needs your eyes to see. So normally you can put it when you're about to go to sleep, or when you just want to relax for a few minutes. Yeah.
But then it has to be, I mean, we can't use it after 24 hours. So it has to be applied at the time when I don't need to read. I guess that's what you're trying to tell me, right?
Yeah. So if
my brand, sorry, the brand I'm using is Vismet.
Yeah, it's a very good eye drops as well. Yeah.
Thank you, Mr. Sim.
Thank you.
I think there is a question in the group chat. Will cataract operation makes the dry eye more dry? How to overcome? From Mr. Su, from Sugo.
Okay, so I think I'll like to answer on that. So yeah, sometimes cataract can actually contribute to a little bit of dry eye. So like I said, it actually depends on which type of dry you have, and the most common treatment will be because you are using different type of drops after the cataract surgery. So the first line of defense normally will be artificial tears. Yeah. So if you are long-standing dry eye patients due to the oil glands not producing enough oil, or you having a low volume of your tears, so we might actually need to tailor the treatment to that. And sometimes we are working together with eye specialist, the eye doctor, to have a more comprehensive treatment for you, because like surgical and things like that, it can be done by optometrists here in Malaysia. So we'll be working very closely together with doctor and to give you a very comprehensive eye treatment. Thank you.
Wow, I think the meeting is more than an hour. So we start at 8:30 and then now it's almost 9:30. So do you think we still want to continue, or because we still have a few questions asked by audience, or we just call off and maybe we can organize a further session that can discuss further?
Yeah. So if anything at all, you can always contact us or Olivia at My Optometry or iElder, or drop us a WhatsApp message, Facebook, Instagram, any channel you want if you have any concerns. Yeah. I'll drop down my company phone number as well. So if you like the slides, so you can actually hit us up or just let us know. Thank you.
So Dr. Kong, you want to have a last word to share?
I think the most important just now, according to TCM, I mean the liver and the kidney is most concerned organs to the eye. So the liver itself, I think basically some emotional also can cause this two organs deterioration. So I think liver normally caused by anger. So let us calm down ourselves, even though we are staying at home, we cannot go out. So I think we must really be happy. And kidney itself, I think through Chinese medicine, kidney, we must do more waist parts exercise. I mean, it's our back exercise. Yeah, especially sit up, raise your leg up and down, this kind of exercise to strengthen your waist, especially your knee joint. Especially when people getting old, you can see the both knee starting to have problem. This is a sign of the deterioration of the kidney. So try to strengthen your leg itself, but don't walk too much. Normally, I ask patient sit down and do cycling. I mean, cycling without cycle. I mean, you can raise your leg because doing so, you can train up your muscle because you lift your leg, your thigh itself, not stepping on the cycling. So try a small cycle and slowly become the big cycles like this. Try to strengthen your leg, then anything can be better, even your eye, yeah, and see far. Sometimes we have to see far away. You standing, we try to see far and then see near, see far and see close. I mean, try to see far and close slowly. I have one exercise maybe we can try. We put this, it should see. We try to see these fingers here. Okay. We try to concentrate on this thumbnail. Okay. And then go far away, the hand slowly. You concentrate on the nail. Yeah. And then come here. And then go further. And close. And then further. Try to do this exercise. You will achieve amazing result for your eyes. Yeah. Try slowly, slow and concentrate. Slow and slow. You can take off your eye glasses to do.
How many times?
Glasses.
How many? How many
okay.
times?
I wish everyone healthy, happy forever. Yeah, that's all I want to say. Thank you very much.
Okay, so Mr. Sim, you want to have any words to say, or we just wrap up for today's session?
Yeah. Thanks everyone who attend our sessions here today, and especially thank you, Dr. Kong and Olivia, for all these wonderful sessions. Yeah, and nice having all of you here. Wish you all have a very good evening.
Thank you, Mrs. Lim, Mr. Kong, and Olivia.
Thank you very much.
Thank you.
Excuse me, can please show the eye drop that without preservative again? I want to snap a picture. Photo.
Okay, so for this kind, actually there are many brands in the markets as well. So find the one who is suitable for your type of dry eye. Yeah.
Okay,
so,
thank you.
Yeah, welcome.
Thank you.
Okay, thank you.
Thank you. Have a good day, everyone. Good night.
Good night.
Mr. Sin, thank you.